nurses keep asking your name and date of birth? Have you ever been admitted to the hospital and thought, why does every nurse keep asking me my name and date of birth? Seriously. The nurse asks, the lab technician asks, X-ray asks, respiratory therapy asks, and then a new nurse comes on shift and asks you again. Meanwhile, you're sitting there thinking, do you people not have computers? Don't you have my chart? I'm wearing a hospital bracelet. I promise, we're not trying to annoy you. In fact, what if I told you that every time your nurse asks your name and date of birth in the hospital, there's actually something else going on behind the scenes? We're performing a couple assessments at the same time. Most patients have absolutely no idea that it's even happening. Hi everyone, I'm the nurse next door. I'm a registered nurse and certified personal trainer with over 25 years of healthcare experience. And today, I'm going to explain, why do nurses keep asking your name and date of birth in the hospital? It's one of the most common questions that patients hear, yet almost no one knows what's going on behind the scenes. Every time we ask those two simple questions, we're actually assessing a couple things. First, we're getting a quick picture about how your brain is functioning. Second, we're performing a bit of a physical assessment while we're talking with you. And third, we're following one of the most important patient safety protocols in healthcare in order to prevent errors. Let's start with your brain. Most people assume we're only checking your identity, and yes, that's part of it. Hospitals take patient identification incredibly seriously. Before medication, before blood draws, before CT scans, and before surgery, before any hospital procedure at all, we're going to ask you to tell us your name and date of birth. Notice I said tell us. We don't want to ask, is your name John Smith? Because it's much safer for you to provide the information yourself. Because while you're answering, I'm paying attention to much more than whether you gave me the correct birthday. Did you understand my question right away? Did your answer make sense? Did you answer confidently? Did you hesitate? Is your memory different than it was earlier today? Those few seconds give me a quick snapshot about how you're thinking. It's not a complete neurological examination, but it's a very important part of my nursing assessment. If you've been answering perfectly all day and suddenly you can't remember your birthday, or your answers become confused, or you don't seem to understand what I'm asking, that's something that I need to investigate. Sometimes it's low blood sugar. Sometimes it's low oxygen. Sometimes a medication can be affecting your thinking. Sometimes it's an infection. Sometimes it's another medical condition that's affecting how your brain is functioning. Those changes can happen surprisingly quickly, which is why nurses don't just ask these questions once when you're admitted to the hospital. We're continually assessing you throughout your stay. Now, here's another thing that's happening. While you're answering my questions, I'm watching you. Most patients never realize they're getting a physical assessment during what seems like a normal conversation. I'm listening to your speech. Are your words clear? Are you slurring? Are your sentences making sense? I'm looking at your face. Does one side move differently than the other? Is there any facial droop? I'm watching your breathing. Can you comfortably finish a sentence? Do you have to stop and catch your breath? Are you working hard just to talk to me? I'm also paying attention to your skin color. Do you look unusually pale? Are you flushed? Do you have a yellow cast? Experienced nurses gather an incredible amount of information in less than 30 seconds. Sometimes The first sign that a patient is getting sicker isn't something that shows up on a monitor. Sometimes it's simply that they don't look or sound like themselves anymore. Now, let's talk about the last reason, and this one is entirely patient safety. Let's say I've been your nurse for 3 straight days. We've talked, we've laughed. I know exactly who you are. I'm still going to ask your name and date of birth before I perform any interventions on you. Why? Because healthcare is designed around systems, not memory. Even excellent nurses, physicians, and pharmacists are human. People get interrupted. People get confused. People get tired. And that's exactly why hospitals rely on standardized protocols before medications, blood transfusions, imaging studies, or procedures. Those safety checks are there to help prevent medical errors before they ever happen. So when I ask your name or date of birth for the 1,000th time that day, it's not because I've forgotten. I'm asking because I'm following a safety process that was designed to protect every single patient every single time. Those few seconds may seem repetitive, but those few seconds save lives. So the next time you're in the hospital and someone says, "Can you tell me your name and date of birth?" you'll know they're doing much more than just checking your wristband. They're confirming your identity. They're getting a quick picture of how your brain is functioning. They're observing your speech, breathing, and overall condition. And they're adding another layer of protection before providing your care. It's one of the simplest things that nurses do, but it's one of the most important. If you've ever wondered why nurses do something that seems strange, or if there's another hospital mystery you've always wanted explained, leave it in the comments, and maybe it'll become the topic of my next video. I'm the nurse next door, and every week I'll help you understand what really happens behind the scenes in healthcare, so you can become a more confident and informed patient. Thanks for watching.